Hi, my name is Sravan Vemuri, and I'm going to be presenting my infectious disease on methicillin-resistant Staphylococcus aureus infections for the One Health Home Medicine course. So what is MRSA? MRSA is a gram-positive bacteria that is resistant to many drugs such as amoxicillin, oxacillin, methicillin, and penicillin. It puts itself in the host and starts getting resistant to antibiotics when used. It's also called the superbug in some cases because it's resistant to many antibiotics. As you can see, it affects many people, but it's asymptomatic in 20 to 30% healthy people, and they're just walking around without any symptoms. As you can see, those are the drugs that are used. Where is MRSA common? MRSA is common in lockers or military personnel or athletes or daycare or school children where they're teenagers and they're going to sports and they start playing and they get sweaty but they don't clean up properly. That's how it spreads. Currently, MRSA is killing about 20,000 people per year since 2004, but when recorded in each country, US came out as the 7th biggest population where resistant bacteria are prominent. It has climbed to number 2 in the past 10 years. What is a global health issue? So before 2005, about 80,000 people were recorded with invasive MRSA each year, and 11,000 people were killed by MRSA each year. The number of children that were hospitalized also doubled between 2000 and 2007. The New England Journal of Medicine actually stated that germ killing and soaps that are used before surgeries in ICUs actually reduced the cases of MRSA by 40% around the major cities in the globe. FDA approved a new drug called Dalvins that is used by humans and intravenously, just by adults, to fight and combat bacteria such as this. So the international law that actually came up, or the international strategy that President Barack Obama came up with in 2014, was to combat bacteria, the spread of this resistant bacteria, and improve the international collaboration and capacities by 2020. He wanted to decrease the emergence of resistant bacteria and the spread of these resistant infections. How does MRSA impact its hosts? It makes a hole in the epidermis, starts making alpha toxins, and penetrates and evades bacterial clearance. Here's the better picture of how it affects the humans. When has MRSA become important? It's documented first in the United Kingdom in 1961 and then in 1968 in US, which is when it's called the superbug. Why is it important? Because it can be fatal, it's resistant, and it spreads really quickly. It's because of sharing personal items such as towels, razors, shoes, underwear, and sports equipment. These are the symptoms. It looks red, it's resistant to bacteria, it looks like a boil full of abscess, and has to be surgically drained. What are the prevention methods? Do not share personal items, keep sanitizing, sanitize before workouts and after workouts, and wash your clothes properly with the manufacturer's label. Look at that. Use laundry detergent. The global prevention strategy would be to decrease healthcare financial costs for lower socioeconomic status people, and so they can actually afford the treatment. And the outcomes for 2020 include decreased spread of these resistant bacteria and strengthened regulatory supply and chain systems to combat such resistant bacteria. Better sanitization for gyms, lockers, and sports for athletes. Thank you for listening, and keep sanitizing.